How do tumor genetics influence transitional cell carcinoma treatment? Imagine your bladder as a busy highway of cells that usually follow strict rules. When these cells develop genetic changes, they can start to grow uncontrollably, forming tumors. In transitional cell carcinoma, which is the most common type of bladder cancer, these genetic alterations are key to understanding how the disease behaves and how it can be treated. Tumor genetics influence treatment decisions because they can tell doctors which therapies are more likely to work and which might not be effective. One important aspect is that genetic mutations in the tumor cells can make them more or less sensitive to certain treatments. For example, some tumors have specific genetic changes that make them respond better to platinum-based chemotherapy, like cisplatin and gemcitabine. Others might have genetic features that make immunotherapy drugs, such as pembrolizumab, more effective. These therapies work by helping the immune system recognize and attack cancer cells, and genetic markers can predict how well a patient might respond. Genetics also play a role in how aggressive the tumor is. Certain genetic abnormalities, like structural changes in chromosomes, are linked to more invasive and harder-to-treat cancers. For instance, some tumors have an abnormal small supernumerary marker chromosome involving chromosome 5p, which is associated with higher invasiveness and a greater chance of recurrence. Knowing this helps doctors decide whether a patient needs more aggressive treatment or closer follow-up after surgery. Immunotherapy has become a vital part of bladder cancer treatment, especially for advanced cases. The genetic makeup of the tumor can influence how well a patient responds to these therapies. Tumors with a high mutation burden or those that evade the immune system through specific genetic pathways may respond better to immune checkpoint inhibitors. This is why genetic testing can be so helpful in personalizing treatment plans. Advances in genetic profiling are making it possible to tailor treatments to each individual's tumor. By understanding the genetic landscape of a tumor, doctors can choose therapies that target specific mutations or pathways. This personalized approach can improve outcomes and reduce unnecessary side effects. Ongoing research and clinical trials are exploring new genetic targets, promising even more precise options in the future. For patients with early-stage transitional cell carcinoma, surgery to remove the tumor is often the first step. Genetic features of the tumor can help predict the likelihood of recurrence, guiding decisions about additional treatments like intravesical chemotherapy or immunotherapy. For more advanced or metastatic cases, systemic treatments such as chemotherapy and immunotherapy are common, with genetic insights helping to select the best drugs and combinations. It's important to remember that tumor genetics are complex and still being studied. Every patient's cancer is unique, and treatment should always be personalized. Consulting with healthcare professionals who can perform genetic testing and interpret the results is essential. This way, patients can benefit from the latest scientific understanding and receive the most effective, tailored care possible. Always seek expert advice to navigate the evolving landscape of bladder cancer treatment based on tumor genetics.